The Olympia Eye and Laser Center is the first in Namibia to offer Navilas laser system. This platform can perform threshold laser and exciting advancement in retinal care, specifically beneficial for conditions such as diabetic macular edema. Edema. Thank you so much. And that is the optometrist, Simon Klausner, who joins us in the studio to give us more information. Good morning, ma'am, and welcome to the program.
Thank you.
Just tell us about this exciting breakthrough in retinal care for patients in Namibia.
Yes, wonderful. And thank you for the opportunity to speak to us today on World Diabetes Day. So my name is Simone, and I'm a Namibian, qualified in 2009 as an optometrist, working at the Olympia Eye and Laser Center for 10 years now. Mm-hmm. My role is to ensure top quality eye care, as well as making sure the patient experience is great. Mm-hmm. At Olympia Eye and Laser Center, we are thrilled to be the first to offer this Navilas laser system. On this platform, we can offer a sub-threshold laser, which is an exciting breakthrough in retinal care, as it allows us to treat the buildup of fluid in the retina, which is, as you mentioned, very relevant in diabetic macular edema. Mm-hmm. So yeah, this treatment allows us to reduce the buildup of fluid without damaging the surrounding tissues. And it makes it ideal for those delicate retinal structures in diabetic patients.
Mm-hmm. So how affordable is this treatment or the care in general for ordinary Namibians who would find themselves with the conditions that you just described?
Yes, thank you. Olympia Eye and Laser Center is committed to using the latest technologies in delivering advanced eye care to patients across Namibia. Our visionary approach means that we continuously introducing innovative treatments, technologies that are in alignment with international standards. And while the state-of-the-art technology is available here in Windhoek at our center, we understand that affordability is a concern for many patients. The treatment is covered by Namibian medical aid, and we encourage individuals to reach out to us to discuss options, as we are really committed to making this accessible.
Mm-hmm. So now Dr. Maretz recently performed treatments using the technology that you have just described. So without going into technicalities, just to take us, you can take us through the process.
Thank you. Yeah, so this technology offers three key aspects. One being precision, safety, and comfort. The platform allows for accurate imaging and planning, which then targets the exact retinal tissue that is affected. The low energy or power levels that are used are minimizing the risk of damage to surrounding retinal tissues. And very importantly, improved patient comfort. So the non-invasive nature of this particular laser leads to a more comfortable experience for patients. The primary beneficiaries of this technology are people with retinal issues, in particular diabetic macular edema, central serous choroidopathy, as well as retinal vein occlusions. In those conditions, the patient's vision is impaired because of a buildup of fluid in their central retina. And the Navilas system provides a precise and gentle treatment option to address those issues.
So what's the duration of the treatment?
On average, the treatment would take 15 to 30 minutes. There is some preparations, like we often dilate the pupil, which may take a good 10 or 15 minutes, so overall an hour.
Mm-hmm. And then afterwards, after the performing of the treatment, and so how long does it take for one to start seeing the results?
Very good question. I think most patients start seeing within a week. It also depends on the condition we're treating and the severity of those conditions.
So what makes this technology different from what's currently available or other types of treatment?
Yes, so most retinal conditions are currently treated with intravitreal injections, whereby the patient needs to be admitted to a theatre and gets an injection. So a particular medicine is injected to the eye that helps with treating these fluid buildups. And that is a lot more invasive, and hence we are excited about the alternative.
All right, so that's the alternative. Any final remarks with regard to the safety aspect, especially for this new technology?
Yeah, so what is wonderful is that for the first time we can actually image the retina and then accurately plan what we want to treat. So we don't just use laser, we actually put a plan together on a personalized way. So the patient comes in, the image is taken, we plan what we want to do, and then we apply the laser. And that makes it exceptionally safe. And with the subthreshold laser, we use such low energy that it really doesn't damage surrounding healthy retinal tissue.
All right, then, well, thank you so much for that update.
I have just something else I want to mention, seeing that it's World Diabetes Day, right?
Yes.
And this year, the emphasis on the overall well-being of diabetics. And as you know, diabetes is on the rise, especially amongst our working population. I know, and I think a lot of people have experienced vision changes in uncontrolled diabetes. So when either patients are not yet diagnosed or when their sugar levels are not optimal, vision changes are very common. And it's essential for patients to regularly check their blood glucose levels.
Regular check.
Yes. The Navilas laser system plays an important role in preserving vision for life. And it can be used as an early intervention, which makes it really exciting. Today, on World Diabetes Day, I urge you, specifically those living with diabetes, to prioritize regular eye checkups.
And also, can the same message be extended to others without diabetes, just for the health benefits?
Yes. In generally, early intervention can make a profound difference in preserving vision for life as well as quality of life. And Olympia Eye and Laser Center is here to support you all the way.
All right, then. So where can I know that for us here in Windhoek, we know where Olympia is, but what about Namibians finding themselves in other parts of the country? Where can they contact you?
Yes, so the easiest way is to look us up on our social media platforms. We do very generally share a lot of the information, especially medical information, on those platforms. And then we have a website, and on all those platforms our email address as well as our landline is available. And I think the important aspect is making those regular checkups a priority.
All right, then.